Screening suspected cases of COVID-19 is taking place at all health facilities belonging to the Ministry of Health.
Today we will demonstrate screening process of a child suspected to have COVID-19 infection at primary healthcare setting, starting from the filtration desk, triage room, taking the swab in the isolation room, and counseling the parent.
Anyone who is attending a healthcare institute should wear a mask at all times. At the filtration desk, patients with any flu-like symptoms should be directed to the infectious zone. Vital signs will be taken at the triage room, and then the patient will be directed to an isolation room. Any suspected cases will be notified in the Tarasud system. Once the patient is in the room and ready, strict adherence to infection control measures should be considered. First of all, introduce yourself to the child and brief the child about the COVID-19 infection, and tell the child that you wear protective clothing to protect yourself and the child from any germs. Make sure your equipment is ready before you start the test. Brief the child about the test. And tell the child that you need to check inside the nose and throat with a bendable swab. The swab will be in the nose for about 10 seconds, and it's very important to stay completely still during the test. Once the samples are collected and labeled, it should be sealed properly and sent to a lab in double bags following the standard laboratory precautions. The isolation form should be discussed and signed. An isolation instruction leaflet should be handed to the parent. If the patient needed any medications, it should be prescribed and given to the parent. Finally, the child and caregiver will be directed to leave the health center immediately. The doctor should strictly follow infection control measures when removing the personal protective equipment. Remember, minimize your waiting time. Avoid touching all surfaces. Only one caregiver is allowed with the child, and you should minimize the number of healthcare providers dealing with suspected cases of COVID-19. Explain the test to each and every child.